Well, hi, everyone. I'm Daniel Williams, Senior Editor at MGMA and host of the MGMA Podcast Network. We are back with another MGMA Member Spotlight podcast, and we have a return guest. He was so much fun to talk to the last time we had him on here. We're bringing him back. So it's Jason Raidbard. He's an executive administrator for the University of Chicago's Ophthalmology and Visual Science Department. Jason, let's just welcome you back in here first to say hello, and then I'm going to read a little more stuff about you.
Well, thank you for having me. I appreciate you bringing me back. I guess I did something right the first time.
That's true. Now, you were telling me something really interesting offline. You just went on a pretty cool vacation. Tell our audience about that, just to get out of Chicago in the winter. What'd you go do?
Surprisingly, it's 55 degrees today in Chicago.
Okay.
My family and I, my wife and daughter, we went to Turks and Caicos. It was actually, the 13th through the 18th?
Okay.
And it is, if you have never been there, I would encourage everyone to go there. The people that live there, work there are wonderful, very friendly, very warm. It is different than the rest of the Caribbean. It's a drier climate. It's 80 degrees and sunny every day. In the fall, winter months, I think it gets closer to 90 in the summer months, but I've never been there. I've only been there in the winter. Grace Bay is the main attraction, at least why we go, many people go, is considered one of the most beautiful beaches in the world. I've traveled some. I have other folks that I know in work and personal life that have traveled more than me, but I've been to a few places, Patagonia, Tahiti, and in Europe. By far, this is the most beautiful beach I've ever seen.
Wow.
And it's just turquoise blue water.
Yeah.
And depending on the angle of the sun, of course, it looks a little more turquoise, a little more aqua, but I mean, it doesn't matter. It's cloudy, you're happy.
Right.
It's a wonderful island. Again, we loved it there. I came back to Chicago on the 18th to 1 degree weather.
Good. Well, I'm just happy you came back. I mean, you might have just stayed there in that 80-degree weather forever, you know?
They've come a long way with their Wi-Fi services there. It still has some work to be done, but it's nice to kind of semi-disconnect. But yeah, maybe I'll see if I can work remote from there.
Yeah,
I'll
just do a hybrid thing, you know? Well, it's so good to have you back here and back on the podcast. So you and I connected because you have been a part of our MGMA Member Community Live programs. You reached out to me, let me know about something you'd been involved in. Just share a little bit how you got involved with MGMA Community Live and what your role was there.
Sure. Well, Dylan Kelly, who I think is one of the individuals at MGMA that's kind of spearheading these community lives, I think it's a good product offering from MGMA for its members. So just to give your listeners kind of background, it's relatively new. I believe it started last fall.
That's right.
There's been a few of them. I think there was an AI segment I got a chance to listen to a couple weeks ago. There was one on eClinical Works a month or so ago. Mine was on culture and engagement. When I get a chance to, whether it's I actually sit on the board of the Illinois chapter of the Medical Group Management Association. So whether I'm going to their conferences, speaking, Becker's Hospital Review, Scott Becker will have me speak at his conferences. Sometimes I'll do webinars or participate like in this format with MGMA, and there's ASHRA and other organizations. I like to talk about culture and engagement, improving not just productivity in the workplace, but, ever since COVID, everything's been just very different,
yeah.
I would say, in society, right? And a lot of things have returned back to pre-COVID norm, but not everything, right? Far more people are working remote or hybrid than they were before COVID.
Right.
It's changing for certain parts of sectors in the United States, but that's still prevailing compared to, say, 2015, if I were to go back 10 years. These member community lives are nice because we had a fairly robust group, close to 100 members.
Wow, that's incredible.
And I serve as a content expert and moderator.
Okay.
And believe it or not, and you can ask Dylan, you can listen to it. I'm sure it's safe somewhere. It went smooth. So folks will sign up because they want to hear about the subject. In this case, it was culture and engagement, workforce development, team development, things of that nature. Whatever it is, the subject that MGMA is sponsoring for that given week or month, that gives members a chance to not only listen to their colleagues throughout the United States, and some maybe in other parts of even the world, about said topic, but then they also have an opportunity to share their stories and their content expertise. So the idea is not that in this case, Jason Raidbard is the only content expert in culture engagement. I can work with this group of 100 people that I don't know, that I've never met, and foster just a large virtual roundtable discussion. So the idea that we call it member community is a very perfect way to describe it. It's a community of members getting together to talk about something that is important to them. And Dylan does an excellent job of managing these, and there's a lot of work that goes into it beforehand. There's a list of questions that he and I, in this instance, worked on, and I think we maybe got through half the list. We had about a dozen questions, because the conversation evolved into other members sharing, and it was not just me. So if you do have a chance to join them, they're good. I love listening to them. You can listen in the background, you can participate, you can do both, whatever it is. It's very easygoing, very casual. And I think a lot of members, at least some of the feedback he got, was positive. People enjoyed the conversation. They enjoyed the topic. I think it's a topic that is, for me, always top of mind, because it sets the tone for any organization, any team. And I mean, you can even translate it into one's personal life with your own family.
Right.
So it's an important topic, and I was glad I had the opportunity to speak, and happy to do it in the future. So I think Dylan and I are working on some things for either the spring and or the fall. One might be a 2.0 of it. The other idea is just focusing a little bit more on leadership.
Okay.
So that's to come.
Yeah. And I'll just add on a little bit. It really is, this community live engagement is part of MGMA's broader efforts to really put the MGMA members at the center of the content that we create. I think a lot of y'all know that I host or moderate most of the webinars we do, about 40 to 50 of those a year. And that's the communication's a little bit different because there's a presenter and people can type in some comments, but it's not really community-led. It's led by outside experts or other people that we get to speak. This, as Jason was describing, is just a great way to really put all of you at the center of the conversation, where you can share your friction points, your challenges in the practice, whether it be related to culture or anything else. So before we move on, anything else you want to share about that? Do you think we've got it covered, Jason?
I think we have it covered. I would say, the nice part about too is, depending on your particular practice or organization's budget, you may or may not be able to attend conferences in person or be able to attend some of the more regional conferences. This gives you an opportunity to still network and learn, but not having to leave your office or your home office, wherever you're working from. Yeah. So for me, some folks can't get to National MGMA Leadership Conference, which is coming up at the end of September, if I'm not mistaken, in Orlando.
That's right.
Shameless plug. But I think it gives you an opportunity. It also gives you an opportunity of what are the folks that you're going to meet at these conferences, and what are some anticipated topics that we're going to get a little bit more involved in when we are at these conferences. And the nice part about the member community is I had people reach out to me through email and LinkedIn direct, wanting me to speak at a chapter, whether it's ACH or MGMA, they were a chapter member wanting me to speak on that subject or a similar subject, or say, hey, I have this problem. Do you know other people in addition to yourself that could help? Yeah. So it fosters really a community of resources. Now, MGMA has a fantastic assortment of resources when it comes to the data dive, when it comes to a lot of the volunteer work, mentoring programs. I think Amanda runs and things like that, and other work I think Nikki does. I'm working on a committee with her a joint task force with improving and enhancing the ACPME testing and certification, right?
Right.
But this is like just another extension, and it's very personable. So I think that's something that when I would go to MGMA conferences, people wanted, and MGMA listened, and here we are.
Yeah. Yeah. So we've been talking a lot already about engagement. We've been talking about how to engage the MGMA members, but we also want to talk about employee engagement. So talking to your peers out there, Jason, the ones who are practice administrators, may have teams out there, as you've alluded to. If we go back just 10 years, the workforce, it looks a lot different in a lot of places because there is remote work, there is hybrid work, there are different ways of doing things. So when we talk in terms of employee engagement, where are you finding success at your practice where you can really engage your team and the rest of the employees there and help them feel like they are part of a team, even though they might not be showing up Monday through Friday in the office? What's going on there?
Yeah, every place I've ever worked, and I've been in healthcare now 22 years. I think after a while I've lost a little bit of track. One thing I learned eventually, and took me a while, is that you may have a playbook of things that you think are going to work. But what I learned once I hit my mid to late 30s and I had some experience under my belt and had really tried to really understand my craft as far as interactions and really trying to understand the concepts of servant leadership, which we'll get to in a second. You really have to understand that every place you go is a different culture. Every place you go has a different set of norms, values. The mission, vision, value statement is going to be different everywhere. There might be some similarities, but how people actually practice it and preach it and what they do and how they interact with each other, whether there's a robust respect level systematically from the top down or from bottom up, or it doesn't exist at all, kind of dictates the culture. Certainly there can be little departments can have their own subculture, right? But you want to be part of an organization that organizationally agrees. I am very fortunate that I work at the University of Chicago, and I will have been here 3 years this April. And I'm not just saying this because I work here. This is a robust think tank. People get along, they help each other, they share. I have a wonderful chair in Sinu Harry Prasad, who's been chair now for a couple of years, full chair. He was interim before, and then Dean Anderson came in a couple years ago and revamped the mission, vision, values. It was a great place when I walked in, and then he came in 6 months later and revamped, the enterprise. Okay. But there's just so many good people that work here. That makes a leader's job very easy. But within your team, and I have a hybrid team, so I have people that are remote, I have people that come in all the time. I personally prefer to come in as much as I can. I just work better in that environment. I like to have the routine. Call me old-fashioned. However, one thing and I can say this with pride because collectively as a group we worked hard at this. I recently got my engagement scores, and I was told, and I'm not trying to pat my own back, but I'm doing this because I'm going to explain to you what I did with my team and how it works.
Sure.
And I think this is fairly universal. I ended up with a score of 4.79 out of 5, the highest in the enterprise. Okay. And the year before, it was pretty much the same. And there's other organizations I've worked when I was at Cook County Health, 2 years. 2 years they measured me there. They didn't measure me all 5. And that was a very, very different culture, completely union, 5.0 out of 5.0. My scores weren't always that way in my career. But what I learned over time is that you have to adjust to what makes people sing. What's important to them? Yes, the organization is going to have certain goals, certain cultures, right? But you also have to make sure that your people's needs are being tended to. They have to be heard. You have to listen to them. Rounding seems so simplistic. Okay, but how do I round if no one's here and I'm the only one in the office? Right. Let's just say, right? And that happened to me yesterday. The couple of people that were remote, one was on vacation or was supposed to be in person, and one fell ill. Okay. How does that? All right. Well, we have technology. We have Teams.
Yep.
We have text. We have email, right? We
Yeah.
have Zoom. You have a phone. I still love to talk to people on the phone. But what I learned with my team is they loved using Teams,
Okay.
the messaging system, but also the impromptu, can I call you?
Yep.
Can I see your face?
Yeah.
Right? Or maybe they don't want to see my face or they don't want you to see their face, whatever. I leave it to them to be adults and be professionals.
Okay.
You want to have hybrid work, as long as I can get a hold of you during reasonable office hours. I'm not going to call you at 9 o'clock at night.
Right.
The hybrid will work fine. The remote will work fine because we're all getting everything we need to get done. We're all communicating with each other. The only difference is we're not in the same setting.
Okay.
Now, do I like it when we have team building? I do call people in. We do like quarterly things where I take them out to lunch or we have coffee in the conference room and we all get together. I think there is some merit to that. But do I need to have that 5 days a week for my team to be effective based on, at least our department metrics, quality, financial, and otherwise? No, we don't. And I can prove it just because I've lived and breathed it the last 3 years. I get a lot of people to say, I just don't think we're very productive as we were before COVID. Okay, well, show me the money, so to speak, right?
Yeah.
Show me the numbers. Let's see.
Yeah.
And I think it's the most important thing with listening and trying to be a good leader is that principle of servant leadership that I learned from a mentor of mine, Rick Beyer, who's CEO of Barrington Orthopedics currently. And this was over a decade ago when I worked for the Advent Health System, which turned into a meetup. And I learned from him what it meant. And we could talk for an hour or two about it itself, but you have to put your people and their needs in front of yours. Mm-hmm. You can't go to people and say, I need. There's nothing worse than going to a meeting and your next up gives you 10 things that they need, and you came in with one problem you needed help with.
Right.
It's demoralizing, right? So if you understand those cues of what is important to people, some people like hybrid work because they're able to pick up their kid on Tuesdays and Thursdays and not have to pay for aftercare. Mm-hmm. Okay, that goes a long way. Aftercare is not cheap, by the way. I have a child. Yeah. Okay.
Yeah.
So you have to kind of put those things in perspective of what's important to people. And you can still get everyone to agree on what's important for your department, for your medical group, for your healthcare organization, whatever the case may be. You can still meet your goals. You can still exceed your goals. But it has to be a two-way street. And I think often younger managers, like myself when I was younger, 20 years ago, missed that opportunity of thinking that, okay, we have these goals and we have to hit them and it's scorched earth to get there. And that's not how life works. If you want sustained results and you want a healthy workforce, a workforce that is not burnt out, a workforce that likes coming to work, I think we've all at one point worked somewhere we loathed, right?
Yeah.
Think about how awful that experience was and what either the organization culture and or your boss or bosses, if it was a matrixed environment, did to you. Yeah. And how that played out. Everyone's had a bad experience. Maybe it was when you served ice cream at the local pool when you were 16, but all the same, the principles are the same.
Yeah. How do you then encourage open communication and feedback? So you're describing a situation where it could be in office, remote, or hybrid. So you've got a mixture of people there. And as you were just describing, yesterday or the day before, there was it was just you. So you were going to have some more face-to-face communication. But what do you do? How do you go about really opening up that line of communication? Because we've all been there where the boss is the boss, even though you might be a servant leader. Sometimes it can be difficult to get people to speak up. And even when they're going through tough stuff, they're really challenged by something. They might not want to, quote, look stupid. And so they don't speak up. And then you're left trying to motivate them. So how do you go about this? Somebody who's got that 20 plus years of experience, how do you bring that team around where you can have, it's one thing, as you might know, to say, I have an open door policy, but then nobody's walking through the door and you're going, come on team, let's get it going here. What does Jason Raidbard do?
Well, anytime you enter a new organization, it's an opportunity to start a clean slate, right?
Yeah.
But even in a current organization, you can still do the same thing. And I keep it very simple. Be genuine.
Okay.
Be a genuine person, right? If you, let's say, Daniel, you were in this instance, you work for me, and maybe you're a coder that I work with, or maybe you're a business analyst or finance analyst, whatever the case may be. If I ask you how your weekend was or where you went on vacation, people love it when other people ask them questions about themselves and inquire, right? People don't like people who just talk about themselves, right?
Yeah.
And you want to do business with people you either, one or both, trust and like. Yeah. Well, you have to build the trust first. Maybe you may like them, but you don't know them. Mm-hmm. How do you get to know it? Well, you've got to find some kind of common ground, some common interests. Start by just getting to know someone first. When you're sitting at your desk and you say you have an open door policy, as an example, someone says, do you have a minute? Can I come in? Well, don't keep typing emails and responding to text messages because that's just not genuine. No. And yes, technology has pushed us as a human race to a point, particularly in this country, but in other modernized countries where we can multitask great with technology. Mm-hmm. But I don't think human beings were necessarily designed originally for that. We've sort of evolved with the technology, and we're still so many people are still adjusting to it, right? Yeah. It can be overstimulating and overwhelming for people between the buzzes and some people get triggered by hearing certain buzzes from certain different platforms that we use every day, right? And you got to ask yourself, why is it triggering? It's got to be associated with some kind of bad moment or bad memory, right? Mm-hmm. Or a series of them. So how do you undo that or try to as a leader? Well, be present. Listen to your people. Ask them for feedback. Another great way to just get to know and get to trusting people is if you have a problem as a leader and you need a solution, you can look to your team for help. They sometimes have the best ideas to fix issues, and sometimes relatively quickly and in a cost-efficient manner. And if you give them an opportunity to participate and you see that whatever was broken is now fixed and you recognize them publicly and in private, it goes a long way to boost morale. And as long as you're genuine about it and you're helpful about it, people will remember that. I still have people from a half dozen, decade and a half ago that will follow up with me and say, I remember when I was going through something really rough and you sat and listened to me for 20 minutes and then got me to a social worker, wherever it was. And this was an individual that was in a really bad spot with some stuff going on at home. And it could be that kind of conversation, or it could be like, I'm having an issue with my computer today and IT says they need you to get involved because it's beyond me and it's a bigger, whatever it is, you have to be present, be there. When you work with physicians in particular, their job is incredibly tough. It doesn't matter what specialty it is. I work with optometrists and ophthalmologists, but whether it's working with radiologists, cardiologists, gastroenterologists, primary care physicians, pediatricians, doesn't matter. You can be visible when they're looking for help or answers, help them, be proactive, right? That's how you build trust. If that phone has been broken for 5 years, I say this all the time, if that phone over there on their desk has been broken for 5 years, and all of a sudden you hear it's broken, and you offer to help, and you actually help, and it gets fixed, they'll remember that.
Yeah. Yeah. I love
it's
that.
It's little things. It's
for sure.
Not, and I can't tell you, Daniel, that like it's some brand. Yeah, there's a lot of people that brand a lot of things, and there's a hack to do this and a hack to do that. To me, there's no hack. It's being just a genuine good person.
We've been talking about how to make that connection no matter where you meet someone in the workspace now, whether it's in person, through Teams, through Zoom, through some other platform. But there can be a downside to, working remotely or working in that hybrid environment. And this is one related to burnout where it can be a situation where there's not an off switch, right? Where, okay, I get out of bed, I walk 10 steps, I'm in front of the computer, and now I'm going. I am working. And I have fallen prey to that at times when I've got a major project going on, and I really have to set timers or something, a notification to remind me to get up and go get some fresh air for 10 minutes just to get away from it. How do you encourage your team to really build a work-life imbalance, not imbalance, but a work-life balance there?
Yeah. No, that's a great question. I mean, I think talking about it, normalizing it is very important because as a leader, whether you're a leader of a department, leader of a large health system that's over multiple states, wherever, maybe you're a leader of a privately owned medical group in, wherever in the United States, it doesn't matter. Normalizing the conversation. It's okay that I have to step away from my desk because I have to pick up my kid at school the day that I'm working remote, because I will cover that 15 minutes that was lost and then some, right? Now, to your question or to your comment, how do you address the off button? Because there can be a lot of guilt associated with it. I hear that all the time. I need to leave a half hour early to go to the doctor. They only had a 4:30 appointment. Okay. Your salary. Okay. You get your work done. Okay. You need to take care of your health. I normalize the conversation about people making sure that they take care of their health. You're no good to yourself. You're no good to your family, and you're no good at the workplace if you're coughing and you're stressed, you got hypertension and all that. There are leaders that don't care. They'll squeeze every bit of whatever they can get out of you and then toss you aside. I don't operate in that space. There are other folks no different than me that don't operate. And that's the shift. When you ask me like how things have shifted, that's the shift I've seen over the last 10 years. And I'll be honest with you, I think it's in part, in some respects, a generational shift of how we approach work and what we value. And that's not to say that I love where I work. I prioritize it, right? But I've got a kid. I've got to take care of her, right? I've got to take care of him. I can work late. I have worked late. I've been there on a Sunday all day trying to get a budget presentation done for the next day because there were glitches in the system. We've all been in a situation like that. I always say we want to limit those to those instances of when we need to push that energy. You as a human, over a year, 2, 5, 10, 20 years, you cannot sustain that. Certainly not without the aid of some other drug, which may be illegal to keep you going, right?
Right.
Because there's no coffee in the world that's going to keep you going. You have to look at it this way. What seems right and normal to you that everyday humans would talk about? Talk about their family lives, talk about things that are going on, being honest, being transparent. But as a leader, sometimes your people will mask and they'll hide that sometimes by just working more, because maybe they do have a bad home life, right? And they just work more to cover it up. You have to, as best as you can, and I think this is very different than leadership probably from 15, 20 years ago. You have to recognize things that leaders from 20 years ago may have not recognized, but it just wasn't talked about from a mental health perspective. And if you notice someone is normally happy and seeming down, and you notice someone is just lagging, there's something going on. Yeah. And if you've built up that trust, you can be like, hey, is there anything I can help you with? You don't have to say, hey, something must be wrong at home. You don't want to do that, right? But just inquire. And you may find out that people maybe are stressed, feeling guilty about working from home. I've had that happen before, where they feel they need to work more. Whether you're working from home or not, you have to come up with a balance that still gets your work done. Generally, my people are always putting in, 7, 8, 9 hours a day. Sometimes they do 10. I don't tell them to do 10. I tell them you have a set of work that needs to get done, and there's certain things that need to get done, and you need to contact me or your coworkers if we can help you, because I don't want that to be 15 hours.
Right.
It's too much. And I think if you can just have honest, robust conversations and just be real honest and real, as they say, it's going to foster a much more productive environment, a more collegial environment. And when you talk about like people staying on the goals and the missions of the organization department, that's how it works. When people feel that they're valued and that they can trust you, that's how, if you ask for help, they'll help you because you've helped them.
Yeah. In the remaining moments here, is there a final thought, like your elevator pitch, your 1-minute little outro you'd want to share with other leaders out there that maybe they have a team they're having trouble getting connected to? I mean, what's something you would want to leave them with in this last moment or so?
I would say, I think one of the things, there's a couple things. When you're having trouble with a team, or you're having an instance where things are just not going well and not working, the first thing you want to look at is yourself. You want to look in the mirror and you want to ask yourself, are you being true to yourself? Are you being the leader that you want to be? You can even ask yourself this, is this the right fit? Am I in the right place? Because you may be a fantastic leader, just in the wrong place, and no matter what you do, it's not working. And I think that's really important too, because I've seen a lot of leaders burn out, leave healthcare because of it, and it really wasn't a function of them. It was a function of just the culture they were in. They were one combating 1,000. There was no way that they were going to change it. And I've been there before too. And you just have to ask yourself, okay, am I doing everything that I need to do? Are the things that I can improve upon? I got better when I questioned myself and said, I can be better. That's when I got better. When I really looked deep inside and said, you know what? I don't actively listen. I assume. I don't pay attention when people come in my office. I'm sitting there texting on my phone. Start there. Because it's so easy in today's society to just point and blame. This is why this is wrong. It's because of he or she or it or that. And that just leads to toxic relationships and toxicity. And that's not a value add to anybody. I think if you get past that point, then it's, all right, what is it within my team that I need to work on and improve and try and help with? And hopefully you have during this time built trust to the point that people will tell you. You may have indications of what's going on, but it's best when your people actually tell you. And when you get to that point, even when things are bad, and I've been there before. I had a group of managers. I remember my score was like 2.4 out of 5. And we just had they liked me, but I was a hard charging leader at the time. And I said, I'm like, okay, just be honest with me. And they were very honest. And they are the primary reason why I turned into, in many ways, the leader I turned in today, because they shared with me. They're like, hey, we need you to do this and that, and be here for this. And so I think if you could just be honest with yourself of where you need to improve, people will see that. They'll see that you're trying. They'll see the genuineness. And if something's working well, you can always ask, like, what are some things that is going well that we want to continue doing? Yeah. Because you want to celebrate the wins. You don't want to always look at it through a half glass full. You want to look at it like, this is 3/4 full. This is a full glass of water. Yeah. And I think if you can celebrate the wins, focus on the good things and build off of them, things will they may not always be easy, but they'll be easier than if you don't do those things.
All right. Well, Jason Raidbard, thanks for joining us yet again on the MGMA podcast.
No, thank you for having me.
Yeah. Well, everyone, do want to just remind y'all, MGMA Member Community Live, it is a great way to go peer-to-peer, to have your voice heard out there and to hear the voices of your MGMA peers out there. It's a great way to do that in addition to the webinars and podcasts like this one. So until then, I'm going to put all this information out in the episode show notes. We're also going to develop an article for it on mgma.com. But until then, Just want to thank all of you for being MGMA podcast listeners.